Hi, welcome to our Healthcare Consultant product launch, brought to you by Life Health Solutions. I'm Dr. Charl van Lochenberg. Today I have the pleasure of being your host, and along with my peers and co-hosts, we'll present market-leading solutions to you and reveal how these can add value to your clients and decrease their health risks. Let's take a look at what's coming up this session. In a moment, we'll meet the Chief Executive of Life Health Solutions, Nicole Corbin, who'll provide us with context into this current landscape and how Life Health Solutions intends to support businesses in navigating our new world order. You'll have a chance to meet our panelists, who are the minds behind these key solutions. Together, we'll discuss how these key integrated solutions can create a workforce of healthier and more productive employees. Then in closing, I'll speak about what today's webinar means specifically for you and for your clients. Now it's with pleasure that I hand over to you, Nicole.
Thanks, Charl. Welcome to our first ever broker launch. I'm excited to introduce Life Health Solutions to you. In this presentation, we'll take you through the ins and outs of our company, our integrated solutions, and the value that it will bring to your customers, and more importantly, our vision and purpose that drives us to make a meaningful, measurable difference to your people and the businesses we serve. Life Health Solutions has been delivering health and wellness solutions for the past 30 years. We have rebranded post the acquisitions of both Careways and EOH Health and Wellness to reflect our solutions and the risk management strategy where it can be utilized for more than just employees. The COVID pandemic and the associated physical and mental health impact enabled us to pivot into a health risk management company, which focuses on understanding the risks and bringing the right solutions. Employees are more demanding and are wanting equal access to healthcare regardless of where they are based. Our digital transformation has enabled this, but we have never lost the human touch. That's the beauty of our integrated solution. Another area of great pride and differentiation for us is the achievement of our Level 1 BE status. And Dr. Leanne will tell you a little bit more on how this has supported clients in meeting their procurement targets. We also remain the only health and wellness company who is ISO accredited across our 4 service lines, and our data insights and trends are best in class. Reality check. Employees of all ages and types are experiencing the impact of stress, fatigue, PTSD, and other mental health issues. And is it any wonder? We're living in unprecedented times. In fact, work-related stress has become a global epidemic, costing the South African economy an estimated 3 billion rand per year. Employee burnout is also on the rise. Data insights are telling us that more than half of workers are feeling burnt out, with 63% of those taking more than average sick days as a result. These are significant challenges facing South African businesses of all sizes, and our current economic challenge is a real daily one for many South Africans. We are in a new world order, and it has us rethinking what work, health, and safety looks like. As a health risk management company, we've built our integrated solutions around real bread and butter issues affecting people and their organizations. We constantly ask ourselves, how can we do things better to meet the needs of our clients and you, our partners? We've been in this game for long enough. We understand the importance of building and maintaining trust with our clients and putting their needs and health risks at the core of everything we do. While our services are not unique, how we deliver them certainly is. So the question is, how do we manage the health risk of our customers? In this hour, we'll unpack our integrated health risk management solutions, our enhanced data analytics, our forecasting capabilities, and how our digital evolution has supported this. This is how we proactively support our clients to better manage their health risks, and this is where we shine. In our business, health risk management can literally mean the difference between life and death. And it's a responsibility that we don't take lightly. Thankfully, we're not doing it alone. Backed by the global healthcare group, Life Healthcare, we are equipped and strongly positioned to take on these challenges. Whether you want to take better care of your employees, your suppliers, your customers, or other stakeholders, as your partners in integrated health risk management, we help you empower them to thrive. On behalf of Life Health Solutions, we're excited to begin this journey with you.
Thanks, Nicole. Right, let's start with the basics. Let's introduce Rhys Oakes, the Chief Operating Officer of Life Health Solutions, to talk us through the basic core product offerings.
Thank you, Charles. Thanks for a great introduction. The value that we bring to our clients is the fact that we can provide end-to-end solutions from occupational health, primary healthcare, wellness, including EWP, executive wellness and organizational resilience, and our emergency medical services. We have seen just how critical it is for our clients to understand the mental well-being of their clients and employees, as this has increasingly impacted on their ability to do their work and be safe. If an employee is stressed around their financial situation and distracted, they are at higher risk of an injury on duty because they are present but not focused. We have seen some interesting trends in our data analytics, which Dr. Leanne will tell us about later. The link between physical health and mental health is more prevalent, and the value to our client is managing it in an integrated manner is key, both from a cost management perspective and operational efficiency perspective, but most importantly, has better health and safety outcomes. Our health and well-being solutions cover employee wellness, executive wellness, and leadership coaching. Our employee wellness program provides professional, confidential support to employees and their families dealing with personal or work-related issues. We provide round-the-clock care in the form of telephone, virtual, and face-to-face counseling. Trauma therapy, counseling, legal advice, health information, and financial well-being are all covered. Our Executive Wellness Clinic provides a personable healthcare experience for executives, senior leadership teams, and individuals who are looking to take their health and well-being more seriously. We give them access to a suite of multidisciplinary practitioners, such as doctors, nurses, dietitians, pathologists, reflexologists, and coaches. It comes with concierge services and on-site pathology lab that does diagnostic testing in real time with same-day results. Leadership coaching provides organizational resilience coaching for executives, teams, and individuals. Working with teams at all levels from dysfunctional to highly effective, our scientific approach transitions individuals and teams into high-functioning, effective ones. We provide virtual and in-person primary healthcare to our customers as well. It is the best of both worlds. We have clinic consultations for clients who prefer in-person sessions, and we have a virtual service that can be accessed on any smart device. By simply booking an appointment on the app, they can engage with a healthcare practitioner in an environment of their choice. It's the stress-free option to primary healthcare. So no matter how our client's business operates, in person, hybrid or remote, our blended approach ensures that the employees have access to quality healthcare. Then comes occupational health and safety. The world of audits and compliance is complex, requiring high-level expertise. With over 3 decades of experience, we are experts at identifying and mitigating workplace health risks. We help employers meet their legal obligation to provide and maintain a working environment that is free of risk and that safeguards the health and safety of their workplace. As part of our integrated approach, we prevent, track, treat, and measure an individual's health and well-being journey. Our medical surveillance detects and manages early signs of disease. It also gathers and interprets employee health information on a continuous basis. We offer on-site and off-site occupational medical examinations to assess employees' medical fitness and detect any changes in their health. How are we able to do this? We hold 2 of the most widely regarded certifications from International Organization for Standardization, making us certified and equipped to deliver clinical health assessments, safeguard work environments, and protect businesses from potential legal liability. Finally, our emergency medical services. Operating across the country, we have dedicated on-site medical services supported by an emergency contact center that is manned by professionally trained medics. From the injury site and throughout the treatment journey, we take care of the patient, keeping the two-way communication flowing between the patient, the employer, and the treating facility. Why these services? Quite simply, we offer health and wellness because we want employees to be well. We offer primary health care because we want employees to be sure. We offer occupational health and safety because we want employees to be safe and employers compliant. And we offer emergency medical services because in these uncertain times, we want everyone to be prepared. Our services are not random. We tailor them to be as adaptable as organizations are. Whether supporting a small business owner, multinational company, or an educational institution, they are assured of our expertise and backing by a global healthcare group, Life Healthcare.
Thanks, Rhys. Now stay with us as we talk to the minds behind Life Health Solutions and delve a little bit deeper into these services and how they're helping their clients stay ahead. And welcome back. Thanks very much for joining us. We're going to take some time now to enjoy a panel discussion. And I'm going to introduce our colleagues back to the group. And we're going to dive a little bit deeper into the products and services that are specific to Life Health Solutions. So if I can start with you, Leanne, we're going to talk a little bit around health and wellness, and then dive into the OC health and the safety aspect. I mean, COVID-19 is the logical springboard. So if we look and we take a data-centric approach to what did we learn out of COVID, and we see particularly the numbers and the caseload that emerged as a result of COVID. Did Life Health Solutions see the same thing? Did the data support that? Did we see an uptick, if you like, in cases?
Well, thank you, Charles. I think we definitely did at Life Health Solutions. We assess our data sets from before COVID, during COVID, and then after COVID. And we can see a definite uptick in mental health issues coming through, trauma, bereavement, financial issues, very important, into 2022. So we definitely noticed it, and obviously we've provided the services and solutions to ensure.
You said financial, so the doctor in me is kind of thinking first aid and antibiotics and tablets and treatment, but the financial health is equally part of a holistic solution for an employer, perhaps. How do you fit that in as a component when you're saying, here's a holistic health solution, but now we're talking money?
So when you look at a person holistically, you can think of them with the psychological wellness, emotional wellness, physical wellness, and then financial wellness. It's critical when understanding the person in totality. So corporates have a critical role to play in educating staff, providing forums where staff can get education on basics of financial wellness, right through to savings and longevity. And we've seen that due to COVID, people have been financially impacted. They've also had a lot of death and had to deal with that and the implications, obviously, because not everybody plans ahead. So corporates actually play a critical role in ensuring that employees can benefit from financial solutions.
Yeah, I see that. We've kind of got this, the big guy in the room is the employer, or the corporate, as you said, right? So the employer takes a huge amount of responsibility. And now we're coming along as Life Health Solutions and saying, you know what, let's share that responsibility. Let's put some clever solutions in play so that you can, fulfill your responsibility to those employees or the people that are working in your space. How can they go about doing that? I mean, what are we particularly suggesting for employers in terms of reducing unsafe behavior in the workplace, for example?
So typically what employers should look at is what is their appetite for risk when they're looking at managing their employees. So that can cover from the employee to the workplace to understand what is it that they would like to put in place. They have to have a strategy, a framework, and importantly, they have to understand what do employees want. And the marriage of the two coming together drives the health and wellness solutions that can be put in so that it's not generic. It's very meaningful for both the organization and the employee.
Nice. Understood. Can we change gears and move into a space that's OC health and safety, which is kind of right up your alley as well? I mean, in basic terms, what is Life Health Solutions putting on the table that says we're a little bit different in this arena? It's a highly regulated, highly documented space, right? And to kind of raise your head above the general delivery, what does LHS do that's a little bit different?
Well, Life Health Solutions really believes in its people. So first and foremost is our training, the skills, the competency of our staff is one of our core focus areas, and that is a differentiator because we invest in our people. One of the other areas, then the spin-off of that, is the patient care. We focus a lot of energy and effort onto that client experience, patient experience, and use that to continuously improve our services. And in addition to all of this, we gather all of our data so that we can assess what's changing, where are the areas of improvement required, and where should the company invest based on what we are seeing.
We're going to get Dr. Reddy just now to talk a little bit to the data issues as well, and kind of utilizing it smartly. But before we bounce across there, maybe let's just look at a couple of specifics within Life Health Solutions where you guys have kind of really done impressive things in the industry. So, for example, the Nursing Trust. Maybe you can tell us a bit about that.
Sure, we're very proud of our Nursing Trust. So it was established in 2017, and it was initiated for previously disadvantaged youth who wanted to pursue a career in healthcare, nursing in particular. And the trust is actually set up to accommodate students right through their training, so typically a degree. And we cover the studies, the accommodation, the books, and so on. And it's at no requirement from the person to work back with us or anything. It's just our contribution towards sustainable healthcare in South Africa. So it's great for us, and we're doing the right thing for the future of nursing in South Africa.
And such an important topic as well. If we think about kind of the nursing conversation or the narrative that's going on in the country, that's just like a little happy story, if you like, around nursing, given what we've currently been exposed to, right? Maybe just before we switch across, something on my mind in terms of setting standards and demonstrating that the Life Health Solutions solution is really industry-best practice, if you like. The ISO qualification system, how does that talk to offering a Rolls-Royce service, if I can use that term?
Well, thank you. Okay, so the ISO accreditation, we're very proud of it. We have spent a lot of time and effort over the years in ensuring that we align to the certifications, and this provides a standard way of ensuring quality frameworks are implemented across all 4 of our service lines to the same level. So regardless of the area of specialty, it meets the same quality criteria across an integrated health, quality and safety management system. So part of that whole journey is, of course, ensuring that we have very strong leadership. Our management processes are in place, our people are trained, educated, and we have this continuous improvement philosophy. And we go through annual assessments as well. So it keeps us on our toes, and we do believe that we can always do better.
And thanks very much, Leanne, for that. We're going to move across to Dr. Pranesh Reddy. Pranesh, if I can bring you into the conversation, because we've got to have a conversation about digitization or digitalization, whatever the right word is, in terms of the very innovative products and services and solutions that Life Health Solutions can offer employers generally in the workspace. Can you talk us into the subject, in terms of what the digital offering looks like and what that journey could entail for an employer?
Sure. Thank you, Charles. So I think the place to start is what our approach as Life Health Solutions is to technology enablement and digitization within this world of company-based or corporate healthcare. And I think in a single line, something that encapsulates what we're trying to do, it's human-centered technology enabled. So we're quite acutely aware that the main component of our world is employees, and people are central to service delivery within our world, and we can't remove them from that, right? But it's very important that we use technology to deliver services in a better way, pass through efficiencies onto our staff and the clients at the end of the day, and bring us up into the 21st century in terms of technology and healthcare. Right. I think everything that we do is very much focused on and bringing South African context into what we do. So the socioeconomic and geographical constraints that we face are very important within our world. Challenges around data, access to technology, technology literacy are very important things that we need to consider. Right? It's not as simple as putting a digital platform in a clinic or at a remote site. We need to make sure that there's internet access, that our staff are able to use the technology that we're bringing in place, and all those factors are critical to ensuring success and value is derived from what we do. So what we're doing at the moment is we have some principles that we use whenever we're taking technology to the market. The first important part of it is ensuring that we involve our staff and the end users in every piece of technology development. At the end of the day, they are the users that are going to use this every day. So they need to be familiar with it and be able to actually efficiently use the technology. A second big component of it is collaboration with our clients. At the end of the day, they are the people deriving value from this. So we need to bring them along this journey as well. Right? And then thirdly, it's ensuring that we deliver a system architecture that makes sense for us from a scalability perspective for the future. So everything we do has to have our future in mind in terms of making sense from the products that we release into the world to make sure that it adds value to our clients at the end of the day. Our overall vision for what we're doing is that we have 4 service lines. So occupational health, employee wellness, primary health care, and emergency medical services. Each of those almost verticals of care will have their own system. But from that, we will be creating a patient record that is derived and based on that individual's sort of unique identifier, which could be an ID number or a passport number. But we'll be building a universal patient record for each employee that exists in our world. What that means is that there's no need for unnecessary capture or repeated capture of medical information at each different visit or access point with us, which creates massive efficiency as well as giving our staff a holistic, unique view of the patient. Right? On top of that, we're bringing into the market a single user application through which users will access every single service that we deliver. Right? It'll almost be their single touch point with our world. And everything that we do in future that's going to be employee-facing or user-facing will be delivered through that application. So that's our vision for technology and how we believe we'll be enabling the service delivery within our space over the next few years.
That's fabulous. We could almost segue into the concept of telemedicine and virtual health services, if you like, out of products that are reaching into the workspace from a distance, if you like, or reaching a remote site, for example. And a remote site might just be around the corner. It doesn't have to be in the ocean, for that matter. Help us understand a little bit about what Life Health Solutions is doing in that telemedical space and how that might offer value to a specific type of client.
That's a very good question. So what we've done, and one of the first service lines that we've digitized fully, is primary healthcare. And what that means is that essentially a clinic is paperless from start to finish. So there's a booking system that employees can use to book visits for the clinic, making sure the clinic runs more efficiently. The entire clinic visit is also captured digitally in a way that data can actually be drawn from it and used to add value to the client and to the employee. And what we've bolted onto that as an additional component is the ability to create virtual clinics or virtual applications. Right? At the moment, we're putting virtual nurses and virtual doctors at the end of it, but our vision around that is that we can put a multitude of different specialities and health professionals at the end of that. So if we need to give the company access to a dietitian or a physiotherapist, that's something that we have a vision for in the future. What's very important around our primary healthcare application is that, once again, it's South Africa specific, right? So we know that all over the world, video consultations picked up during COVID. And part of what happened in South Africa is that legislation changed, and that made the adoption of telehealth or virtual healthcare far more prevalent. At the same time, we learned lessons during COVID that people have difficulty, like I mentioned, around access to data and technology. So we need to be aware of that. And something as simple as enabling telephonic as well as video consultations is very key to what we do. Something else that we've done is we're able to be very flexible and enable setup for this depending on the company's needs. So whatever the payment options a company wants to make available for their employees, we're able to set it up in that way. So if a company is willing to cover the costs of these consultations, that can be done and the employees would never see a fee. Similarly, if they'd like the employees to co-pay or use a medical aid potentially in the future, that would be enabled through the system as well. So we've been able to cater for the future and for multiple different ways in which a company is willing to give their employees access to care.
Thanks, Panish. In fact, before we shoot across to chat to Nicole about the emergency medical services component, maybe one last concept that you can unpack a bit for us, the utilization of data. Because you're sitting on a wealth of data, essentially, and in this wellness space. How do you utilize that, and then how does that enable a conversation effectively with the client?
Thanks, Charles. So data is obviously a very hot topic at the moment, and we know that people believe there's value in healthcare data. And our approach to it is that unless it's used correctly and the correct insights are applied, it isn't really of much value. So key to what we're doing is all our 4 service lines will have the ability to collect valuable data at the point of service, right? So for an occupational health medical, that would be at the time that the medical's done. Similarly, for a primary healthcare consult, similarly when you phone our EWP care center, and then also with the EMS call center as well. So what we're doing is we're collecting information based on those 4 service lines and aggregating it based on an employee's essentially unique identifier, which could be an ID number or a passport number in our system. And we start to build an electronic or employee record of this employee's utilization across our 4 service lines. We've then taken a different approach to this. So we're taking an approach as to see how do we get the best impact or value out of the data. What that means is that we're looking at what matters to companies. So in the mining and manufacturing industry, things like injuries on duties or critical incidents are what affects a company's productivity and its output and essentially its profitability. So we're working with looking at the employee type or profiles involved in those critical incidents. Everything is de-identified or anonymized, so we're not actually exposing employee information at all. It's just the characteristics of that employee from an HR perspective, from an employee wellness, occupational health, primary care, and EMS data perspective. We then aggregate and overlay all those 4 data sets, and we start to build essentially what is a profile of the employee type that would be involved in those critical incidents. Once we've profiled this, we're then able to say, okay, this is the type of employee that we need to target, right? We will then put interventions out into the world to be able to proactively manage things that we saw as risk factors involved in critical incidents, and from that, then measure, did they make a difference? And this becomes an iterative cycle. So the first part of it might be reactive or retrospective, looking at historical data sets, but then from there on, we can actually build on that data set and it becomes real-time and live. And as the employee profile changes over time, we feed into that model, and then we start to change the different interventions and proactiveness that we're starting to bring into the workplace. I think what's also important is that data is central to delivering personalized healthcare. A big part of what we're doing with our systems is the ability to tag and label certain aspects of an employee. So that could be the medication they take or chronic conditions. What this means is that we're then able to deliver targeted interventions at your diabetic, hypertensive, or other chronic disease populations, which means we're far more proactive in identifying and bringing better care and value to chronic disease groups. And central to this is data and good quality data. So our big approach for us is ensuring we get good quality data in so that we get good quality outcomes out of that.
That's a great opportunity to open the conversation to the Chief Executive. Nicole, we can talk emergency medical services for a little bit, because that is the line that Pranesh referred to a little earlier. And if we think in terms of the functionality that he's just described, the sort of central outbound ability to communicate with clients, interface with potential patients, maybe as an opening, tell us a little bit about the Life Health Solutions contact centre. Contact centres, plural, actually.
Yes. No, thanks, Charles. We have 4 contact centres, so 2 in Johannesburg, 1 in KZN, and 1 in Cape Town as well. One of the contact centres focuses on the psychosocial support, the other one EMS, and what is absolutely critical for us is that first-time call resolution. So if somebody phones in either to get psychosocial support, it's a social worker or a psychologist that answers the telephone. I always think someone's very brave when they pick up the phone and ask for help. So you want to make sure it's not a chatbot or someone that wants to divert the line, but they can get that first-time resolution. EMS is very similar. So we've got trained medics or paramedics answering that call. I think whenever injuries happen or someone phones in for help, every minute counts. So having somebody who could guide you through the process, tell you to what you could do next, and more importantly, activate those support services. We're not affiliated to any one EMS service provider or ambulance. So what our medics are able to do is call the closest ambulance to respond. We're able to locate and find the most appropriate clinical care. Ironically, we transfer more patients to our competitor than our own hospitals, but that's because clinical relevance is the number one thing. So if the right specialist is sitting in a competitor's hospital, that's actually where we'll direct it. I think one of the big value adds that I've personally experienced when one of our staff was admitted is the sort of case management process thereof. So these paramedics will then engage with the employer, engage with the family, keep everybody up to date on what's happening, what's the process, make sure the most appropriate care is involved. If necessary, contact yourself to make sure that the right emergency medicine's being applied, and really supporting that employee get back to work. We want to make sure that we give the right support, whether it's psychological, physical, through the right rehabilitation and supporting someone to get back to their former selves.
And would you say that case management is one of the sort of differentiators or advantages of being in the Life Health Solutions space, specifically because you've got this ability to cherry pick the best of what's available and required for the patient, right? So you've got the structure that sits around the patient and then follows the patient on their journey through whatever their needs might be, from that emergency event and as you say, ultimately the return to work, right? They're going to
Yes.
move through the healthcare situation, hopefully steadily improving, and at the end of the day, you're getting them back to work. So would you agree that that is a critical differentiator?
Absolutely. Thanks, Charles. And I think what makes us different is the way that we do it. So it's clinically led. It doesn't matter who the service provider is. If they've got the right clinical skills and expertise, we pull them in that patient journey. I think people get lost in our healthcare system. We've got a very siloed healthcare system, so our case management process really holds the hand of that individual through the entire journey. It's absolutely critical when you're wanting to support employees. And what is amazing about this is you don't have to have paramedics or an ambulance based on site. So some of our even more traditional white-collar financial services client utilize our case management call center. We're able to support and guide them in whatever we need. And this actually grew organically through COVID, where we're supporting our corporate clients in finding hospital beds, making sure the families were updated. And we were often that voice that was able to transfer messages over, speak both to the family and to the employee that was admitted. So we're really using the skills and what we're really good at to support people in their needs in that crisis point.
It strikes me that the sort of next space to have a conversation is about how to plan those emergencies away.
Yes.
And the idea of not having one and putting the emergency guys out of business effectively, right, which is the ideal. So if we talk emergency preparedness and you're going to have a conversation with a client, an employer around emergency preparedness, how do you go about having that conversation? Maybe using as an example either injuries on duty or injuries in the workplace, off the back of the very turbulent year that we've had. You know, we used the KZN situation by way of example. How does that enable you to have that emergency preparedness conversation?
So I think what's been a key differentiator is, besides being the only health and wellness provider who can offer these 4 service lines, really integrating and bringing in our skills and expertise to support the employer. It's not always fun and games, but you are looking at worst case scenario, understanding the risks and asking the what if question. Unfortunately, community unrest is a reality that we deal with on a regular basis. So supporting our employers to understand if something should happen and you press that panic button, who do you call? What is the flow of information? How do you make sure that the right support is activated? Where we really see the benefit of integration, and we've seen where we've gone to support one of our clients and we talked about if somebody was electrocuted underground, and sadly it happened the following week. And it really highlighted the need to not only know what to do in the case of emergency, but if you press that button, someone's going to respond. Where we've really seen the benefit of integration is when we bring over the wellness component, and this is often forgotten. These are traumatic events. Unfortunately, accidents still happen on a regular basis within our mining and manufacturing environments, and giving trauma support and debriefing not only to the individual recovering post that, but to their colleagues. They're seen and exposed to horrific things. And we're able to activate, have those social workers deployed on site, do the trauma counselling and debriefing, supporting those employees and their colleagues, because PTSD is a reality in our world. Sadly, in South Africa, we see, Leanne, correct me if I'm wrong, complex PTSD. It's not a matter of when it's going to happen or if, but it's almost a guaranteed reality. Some of the support that we provide for our retail providers, I think it was every second day, there's a robbery in one of their stores. So we're constantly having to support and build that resilience, because it's not a once-off event. They get exposed to this trauma all the time, and we make sure that when our emergency medical services are activated, we're able to, because of the integration of our contact centers, the psychosocial support and trauma counselling is activated simultaneously. So we run these services in parallel to make sure it's not just the physical health and wellness and that injury that's looked after, but really the trauma that manifests thereafter.
Thank you very much, Nicole. I think that rounds it out very nicely, and thanks to all 3 of you for the contributions in highlighting those different channels within Life Health Solutions. We've talked to the health and the wellness component. We drilled into a little bit on the occupational health and safety specifically, and then moved into how that becomes innovative, the use of digital products effectively, the technological landscape that allows us to operate effectively in that space and competitively, and then rounded it out with the emergency medical services element and the clinical services and managing the case in this holistic journey for the patient. So thank you very much to all three of you. Hi again, Nicole. Wasn't that a great panel discussion to close off with? And I think you can get the final closing remarks with maybe some takeaways for our clients.
Thanks, Charles. Key for me, if I was a broker, was why pick Life Health Solutions. We're the largest health and wellness company in South Africa, the only one that's ISO accredited across our 4 products, very proudly level 1, and our clinical data and integrated health risk management is second to none.
Perfect. There you have it, Life Health Solutions in a nutshell. You can get some more structured material, it'll be sent your way. Otherwise, you can reach out to us with any questions. Thank you for taking the time today to listen to this session. Goodbye.